Gargi, you start.
Hi, everyone. I am Gargi Trivedi from NAAREE Women's Group. And today's session is especially with these qualified and very interactive and very busy doctors of our New Zealand. And Suchitra is from Australia. I would like to thank you all doctors for taking time out today evening for us. And I'm sure we're going to have a lot of interactive sessions because at the peak of this Omicron and COVID, we all have a lot of questions. So I would just hand it over to you, and a big thank you from the entire NAAREE group to each one of you all.
Thank you.
Thank you, Gargi. And I thought you would want to introduce some of them. If you want to do a little spiel and introduce the doctors who are here, and then I can take over.
Right. I've got Dr. Suchitra, who is cardiologist, and she is from Australia. She's joining us from Australia today. We've got Dr. Rakesh, who is a GP and based in Wellington. And then we've got Dr. Bhavna here. Thank you, Dr. Bhavna. She's also from Auckland. And then we've got Dr. Primla Kar, who is here from Auckland and a GP with us today. Thank you.
Thank you, Gargi. Thank you very much. And sabko namaskar.
Namaskar.
Thank you for joining. Before I say anything else, हम सब कराकिया करते हैं, पूजा करते हैं. So आज मेरा मन हुआ कि हम सरस्वती की वंदना करें, एक छोटा सा मंत्र जाप करें. सरस्वती नमस्तुभ्यं वरदे काम्य रूपिणी विद्यारंभं करिष्योमि सिद्धिर्भवतु मे सदा. So just a small intro of praying to Goddess of Knowledge Saraswati, giver of boons and fulfilling our wishes. My salutations to you. We are beginning our education. Every aspect of our life is part of education. So आज भी ये education session है. May there be always accomplishment for me, for us, for all of us. And the accomplishment is empowering our people, those who are around us, our families, and the community as such. So thank you. Before I open up the floor to such magnificent group of doctors who've joined us, I would like to acknowledge the presence of Dansuk ji. He's the president of Auckland Indian Association. Lovely to have you on the session as well. And I have some wonderful people, Arvind ji and others as well. So I won't be naming everyone. We will open the floor. The intention of today's session is to have it as an interactive session. Pehle bhi humne ek session kiya, which was really, really successful. People really enjoyed it. So we want to take away the hierarchy of, doctor wahan hai, patient yahan hai. So we are on level fields. So I would want everyone to join in, and you have an opportunity. Either you write your questions in the chat box or you ask them. If you are going to ask them, let's have it as a very nice, cordial, collegial, professional interaction. Please put up your hand. I'll try my very best to make sure I know who's raised their hands first, and we'll go in sequence. So that's the intention. And these lovely doctors are going to take a question as it comes and goes. And we will, hopefully we'll have some fun. Omicron ne to sabka mental health uda diya hai. So,
absolutely.
Yeah. So the intention is ki, let's give everybody some hope and take it from there. So before we start, can I, and sorry, I have to say this. Rakesh is from Wellington. He said he's the only odd person out, and he's also the odd male doctor. So Rakesh, I really respect you coming forward.
Thank you.
You're from Wellington. Tell us how things are with Omicron in Wellington, and just a minute or 2 minutes of introduction, where you're coming from as far as Omicron goes.
Yep. Well, in Wellington, we just started seeing patients, so we didn't actually have much of COVID here. until a few weeks ago. So it's really picked up in the last 2 weeks, in particular, since this outbreak obviously has happened in things have really picked up. I mean, like case numbers are going up quite a lot, quite exponentially as compared to what we have experienced before. Obviously, you probably have had a good experience in Auckland with the number of cases, but we've barely had any cases. When there was this Delta outbreak, I mean, we hardly had any cases. That was good in one sense. But now with the Omicron, the things have changed quite a lot. So we're seeing a lot of patients. I mean, I never had any patients up till recently, and in the last 2 weeks, every day we see a few patients every now and then. But thankfully, things are not too bad. I mean, most of our patients are quite good. They despite the illness, they're being managed in the community. So none of them has been hospitalized, but even in our practice as well as a whole, none of the patients have been hospitalized. So thankfully things are fine. But I mean, I think things going to change, obviously, with the numbers going up, with the it just penetrating into the households, with the elderly people getting involved. And I expect there would be some sickness. I guess there would be hospitalizations. I expect them to happen. So, but for now, things are fine.
Yeah,
Not too bad.
That's
Yeah.
great to hear from people sitting in Auckland who've borne the brunt of Omicron. It's really good to know that you're not part of what we are going through. So can I let everybody know that Dr. Rakesh is from Kashmir, graduated and did his postgrad study in orthopedics in Jamnagar, Gujarat. There are a lot of Gujaratis here. They would really love to know you better. And you worked in NHS UK for about 3 years, and then you moved down to Wellington. So he is a practice owner in Wellington, and an extremely intelligent young fellow. So lovely to have you, Rakesh. Lovely to have you here.
Thanks for your
So while
I've
I've got you there, can you what I'll do is I'll start the chatting here, but I want people to write on the chat whatever the questions might be. Traffic light system, and then now changing, phases, and phase 3 and phase 2. What are the important points that you would want to make at this point of time that people should know? Phase 3 में हम हैं, 2 दिन पहले change हुआ है. As a doctor, what would you tell your patient? Anything specific?
Well, it's such a changing situation. I myself get really confused about it. I mean, things change so fast. One day there's one rule, and the other day it's a very different rule. So, I mean, I find it very difficult to kind of keep pace with it. And invariably, my patients have actually corrected me. I mean, we're in a different kind of situation now as compared to what we were, say, yesterday. So, I mean, but it's the virus is the same. The important thing to remember is that the virus is the same. And I think with the Omicron, my belief is that we are in a different setting as compared to what we were, say, about a year ago with the original COVID-19 and then the Delta. Thankfully, I think, I mean, from my from what I've heard from my colleagues back in India or from the UK as well, it's a milder a viral mutant, and hopefully I think we'll be fine. We'll sail through it because it's more of an upper respiratory thing. So I'm hoping, and that's what I'm giving my patients reassurance that this is not the same severe virus that was there, and we're vaccinated, so we've done our best what we can. And also it's a milder virus. It's an upper respiratory virus. It's not a lower respiratory virus. The mortality is less, but yes, it's infectious. But the important thing to remember is that it's not the mortality or the hospitalization rates. I would probably are not going to be as bad. So I think there is hope.
Wonderful, thank you. So okay, I'll let you take a bit of a breather there, and I'll swing to Bhavna. So Bhavna, you've been our immunization and vaccination expert in our previous conversation as well. Just letting you know that I was on a meeting where I mentioned about if a person is immunocompromised, they can have an extra dose of the vaccine. And that is where Gargi pinged me and she said, nobody's talking to us about this. So Bhavna, the floor is yours. And if you want to give a spiel about what you want to say about vaccines. And before you do that, I just want to say Bhavna is an absolute gorgeous person. She's a general practitioner. She owns a practice. She's a very, very dear friend of mine. She's a medical educator. And at the drop of a hat, she will put up a hand to come forward. So thank you very much, Bhavna. It's yours.
Almost forgot to unmute myself, but thank you. And lovely to meet everyone here, and looking forward to getting lots of questions. So in terms of the vaccines, so in New Zealand, we've had our first and second doses. With the patients who are immunocompromised, so those are the ones that are more vulnerable to having a funny immune reaction when they do get Omicron or Delta, and more likely to end up in hospital. For those patients, we've been offering something called a third dose. We don't talk about the booster with the immunocompromised. We just talk about the first dose, second dose, third dose. After the third dose, those patients will still be offered a booster, which the rest of the population gets. So the rest of the population gets the first dose, second, then a booster. The boosters have been rolling out pretty much end of last year, but they had to be 6 months from the second vaccine, which is why they were slow to get picked up. But with the Omicron arriving in New Zealand, we've shortened that time between the second dose and the booster from 6 months to 3 months, which is why there's a big push in New Zealand now to get your booster done quickly. The reasons for that is we do feel from overseas studies, England, Australia, is that the booster seems to be a little bit more protective against Omicron. Now, my thoughts are we're all likely to get Omicron this year. There's very little way around it. But the fact that we are vaccinated and boosted means that our illness will be milder. So it's really great that everyone has been vaccinated, and I would still push the vaccinations and boosters for protection and minimizing, reducing how awful the COVID-19 could be for us. The idea is hopefully we get it like a cold. I've seen a lot of people who've had it like a flu, so body aches, high fevers, headaches, feeling awful, but just for around about 3 days and then slowly coming right again. And so that's I'm just really grateful that New Zealand's got the push with all the vaccines and the boosters done far earlier than other countries were able to do before Omicron hit them.
Thank you, Bhavna. And while you're there, I see there's another doctor from Brisbane. She happens to be my sister. She's joined in, which is great. And she says, here in Brisbane, we are giving 4th dose 3 months after the 3rd dose for immunocompromised patients. So Australia always does things a little different, isn't it?
They do.
That makes them special. So thank you very much for that, Sunanda. And thank you, Bhavna. I'm sure we'll come back to that. But while I've got you there, I've got a question here from Gargi who says, does Omicron just remain till the throat? Do you want to take that?
Sure. So Omicron doesn't remain just in the throat. We suspect if you get a mild illness, it may just present as a sore throat. And so anyone with new sniffles, new runny nose, or new mild throat might still have Omicron. Everyone's immune reaction is very different. So some people will just have the mild and some people will have horrible flu-like. But the whole idea is if you're vaccinated, everything's milder. As long as you can ride through the first 3 to 4 days, most people will be okay. But please, if you're not improving, feel really short of breath, hard to breathe, that is the time you do contact your GP or Healthline or hospital or after our services to get a review or an assessment.
Thank you. While we've got you there, so can I get you and Rakesh to please help answer what, as a lay person, when I go for my test, I'm not told whether it's Omicron or Delta. We know Delta still exists. So do you guys want to play tag and tell us how is it still different? Does it really matter? I shouldn't be bothered about that, or what? Bhavna, since you're still going on.
Shall I go first? So there is a difference between Delta and Omicron. And like Rakesh said a bit earlier, Omicron is supposed to be a more milder variant. Delta could still be around, but we saw those numbers go right down in New Zealand. So I think Delta wasn't as infectious as Omicron. The fact that our numbers are like exponentially huge, we're into the thousands now, it's more likely that the most common virus out there is the Omicron variant. The way that the COVID swabs are done, they can be better analyzed through the hospital system to tell the difference between Omicron and Delta. But in the community, if you're sick and it's mild, it's most likely Omicron, you'll be fine. If you're feeling terrible, you're still going to seek help from your GP, and we will organize a swab or just a rapid antigen test, and we'll just support you through it. Yeah, Rakesh, shall I?
Yeah, I agree absolutely. It's probably doesn't really matter now what we have. I mean, whether it's the original one or whether it's the Delta or this Omicron. But yeah, it's I think it might be more important if somebody's hospitalized or somebody's in the ICU and they want to kind of determine what it is, or probably for statistical, maybe for academic reasons, I guess, so that they kind of know whether which virus is the more killer version. I mean, given that most people are vaccinated now, it might be more relevant there, but probably for the community, as I said, probably not as important.
So shall I say, if I've got COVID, I think it's Omicron. Don't think beyond that at this point of time. Is that what you're saying? So does that answer your question? Dhansukh-ji, you and I, we were sort of thinking in tandem here. It was your question, and I hope you.
Yes, I was typing and you asked the question, so that's fine. Thanks.
Fabulous. We work well together. So do you want to extend your question? You have an opportunity if you wanted to get any more clarification while we are there.
No, I think both Dr. Bhavna and Dr. Rakesh have clarified quite a bit. So yeah, I was just sort of wondering whether when you go for a test, whether it's Omicron or Delta, does it matter? But like you people have explained, so it's good.
Great, thank you. And yes, Suchitra, you can always jump in. I haven't introduced you.
If I may add, I guess it matters whether you have Omicron or Delta. From a treating doctor point of view, it matters in the hospital setting, particularly when you're sick enough to go into intensive care or requiring very high oxygen requirements, because now we have about 4 or 5 different antiviral drugs that we use. And it seems to help us to know which one it is as to what drugs to target in the initial days of treatment for the very sick patients. Don't know how it is done in New Zealand, but in Sydney, where I work, Australia, we had in December, January, both Delta and Omicron were raising their head. Our hospitals were full, intensive care units were getting full. We actually decided to start sequencing whether they were Omicron or Delta only in people who were going into intensive care, because that's where it mattered what it was done. But for the really people who are mild symptoms, it doesn't matter what you have, as both Dr. Patel and Dr. Kaul have very nicely elucidated. For the layperson, you've got COVID and you follow the set rules of COVID. When it comes to mild, when you're isolating at home, it doesn't matter. The only other caveat, and I'm sure others will raise this topic, is the fact that Omicron seems to be more highly transmissible, about 3 to 4 times more transmissible than Delta, and Delta was 2 or 3 times more transmissible than the original Wuhan virus. So you just have to be that much more careful about staying away from people if you test positive. That's all.
Thank you, Suchitra. Thank you for jumping in. And I want other doctors to come in and support each other's answers. And before I actually introduce you, do you want to take this question as well? Can we get a combination of Delta and Omicron, Suchitra?
Most definitely can. and has been seen a lot, particularly in India, where I've just come back from, where there are many patients admitted to hospital with both strains. Purely because the vaccination level is not quite up there yet in India, and the density of population makes it very hard as to who you're exposing yourself to. And yes, there are individuals who have both strains. For instance, when I was in India, there was a 28-year-old man who came from the Netherlands to get married, as you do in India. And 5 days after his wedding, developed symptoms. And within 24 hours, his oxygen level dropped and he had to go into hospital. All he had was asthma as an underlying condition, but he recovered exceptionally well within about 3 to 4 days, but had to spend time. And in him, for instance, they detected both Delta and Omicron, and this was specifically asked for because his clinical course was different for somebody with just Omicron.
Thank you. Thank you, Suchitra. And Gargi, I'll take your question, but I do need to introduce this fabulous doctor. Suchitra Chandra is a cardiologist practicing in Sydney, Australia for almost 25 years. She completed a PhD in molecular mechanisms of familial dilated cardiomyopathy. Doctors would understand. While her interests are in clinical cardiology with a particular interest in heart failure, the COVID pandemic drew her into telemedicine support of individuals struck by COVID-19 in her home country, India. That's where most of us are from, during both Alpha and Delta waves. She joined a purely voluntary group called Project Step 1 in mid-May 2020. This small group started as a WhatsApp group and has, how many? 7,000 doctors and 10,000 non-medical volunteers. Fantastic, mind-boggling figures there. You guys triaged, you helped with COVID triaging, and you worked with the government as well. More recently, she has been involved with GM4C, which is the Sarthak Foundation, the Global Doctors. And I am privileged to be part of that as well. And that's where I have known Suchitra, and I see her brilliance just come through all the time. And this is a group of doctors who have been volunteering their time remotely to support patients back in India. So that's Suchitra for you in few words. Thank you, Suchitra, for being here.
That's a lot of words.
Thank you.
Yeah, thank you. Thank you for having me. It's really lovely to meet all of you from across the ditch.
Now, I will, you're welcome, Suchitra. And I'll go to maybe Rakesh for this, and then I will come back to you, Suchitra. But this is a question from Harud. When are we expecting rats, rapid antigen tests to be available at the GPs and pharmacies? I called 5 pharmacies on the shore yesterday, and they haven't received any yet. Likely next month, but nobody had a confident response. And what is the likely price for these testing kits? If any one of you know, maybe we ask Chitra, is it available in Australia at pharmacies?
Yeah, yes, the short answer is yes now, but back in January, it was all on back order, and people were buying up rats like crazy for the simple reason that people were getting the RT-PCR, which is the main test that everyone gets done, the swabs when you're looking for COVID. We were so swamped with the sheer numbers. To just give you an idea of numbers, we had, much like New Zealand, 10, 20, 30 cases a day in the early part of 2020, for most of early part of 2021. And we peaked at 155,000 cases a day in New South Wales alone in January. So to get testing people with COVID, their close contacts, people going back to work. So the testing system just collapsed. And that's when the rapid test came into play, and everybody was asked to do the rapid test, and hence everybody went to the local supermarket and bought up. So there was a shortage, but now we have availability. Here, the cost is still around the ballpark of about $10 per swab, maybe a little bit up and down, but in the ballpark of $10 per swab. Having just come back from India, I find that the cost equates to equivalent in Indian rupees in India as well. So it's about $500 rupees per swab, per test.
Great, thank you. Bhavna, I think you've already answered, but do you want to just give a spiel?
Sure. So the rapid antigen tests were a bit slow to be delivered to general practices and pharmacies, and they're still working on that. But there's a lot of pharmacies and GPs already had some stock and have started to be able to use that as of Thursday last week. If you are sick, GPs will be using the RATS test first instead of the COVID swab. Unfortunately, in Auckland particularly, our PCR nose swabs, they're taking well over a week for the result to come back. And so as of Thursday, we have been encouraged to use the rapid antigen tests as testing for sick people. Those will be free. If you are sick, you shouldn't really be going to a pharmacy to get a rapid antigen test, but you can go to a testing station and they will be also offering a rapid antigen test in favor of a COVID swab for diagnosis at this stage. Now, if you want a rapid antigen test just to have at home, just to check whether you wanted to before going to work, that is, I think that you will be charged for. But if you are sick, currently in New Zealand, the rapid antigen test, if it's being used, should be free.
Thank you. And I get another comment here. It's free in hospitals from Sunanda in Brisbane, free in Brisbane hospitals, but GPs don't have it there. Yes, pharmacies have it for sale there. So it's the other way around. In New Zealand, it's the GP clinics that are going to get the RATs first. Pharmacies are in queue. Rakesh, have you tried buying RATs online? Have you checked how much would it cost?
Yeah, well, yeah, I just saw
Any
the
idea?
other day. Chemist Warehouse had it for about $44 for five test kits.
Okay.
So it's around about probably about $9, I guess, but I don't know about the rest of the pharmacies. I mean, even we are struggling to actually we don't have it. I mean, in our medical center, we don't have any RAT tests for the community patients at the moment. I mean, like, if when I check the website, the government website, they say, well, if you have any symptoms, the RAT test is the one that is going to be done. But if somebody comes to our practice tomorrow, we don't have that test at the moment.
Yeah, and you'll get a backlash from the public.
Yeah, absolutely.
I sympathize with you. I think what is happening is because Auckland has a monopoly on COVID at the moment, so that's why right. Wellington is just lagging behind.
That's lagging behind, absolutely.
Yeah. So I heard $49 online. Is it, Suchitra, do you think, sorry, before I come to you, Gargi, you still have your hand up. Was there a question or is it from a previous question? Oh, right. Suchitra, do you suggest people should stock up RATs? And if you say yes or no, if it is a yes, how many? And when and why should I use it? Or is it just going to be a fad? I go to a dinner party and I have 5 RAT tests in my
Good question. It's not going to be a short answer, yes or no. Forgive me for this. Very good question. We're all coming out of our lockdowns and what have you. New Zealand is a little bit different. So I'll defer to your doctors to tell us, to you 3 doctors to tell us what's happening there. But essentially, Australia has opened up, except for Western Australia, of course. We'll leave them out. They're a separate country almost. But the rest of us have basically opened up. Anybody can come in, anybody can go, you can do what you want. We don't need to wear masks anywhere. We have no restrictions on numbers at weddings and what have you. So that leaves the onus of actually deciding what to do with COVID on the individual. So this is a decision that not your doctor, not your government, but you as an individual need to assess for yourself. And I think educating yourself as to where the highest risk of infection is, who is at the highest risk of transmitting it, who is at the highest risk of getting it from another person. I think we as individuals need to understand, and we need to take responsibility for it, I guess. So yes, I do have a box of 5 swabs at home always. If I've used one, I replace it. Why do I have this? Say I get now invited to a wedding, as I did last weekend. We don't know who's coming there. You have about 300, 400, 500 people, what have you. You go there, you don't have much by way of symptoms, but maybe, a day or so later, you feel a little bit funny. You test yourself, you're positive. Then do you go back and tell all the 300 people, hey, I came to the wedding, I'm tested positive. You've got to go and get yourself tested. Or do you tell them, wait for symptoms? So that's a big question. So the question, I guess, in terms of purely focusing on the number of RAT tests is just knowing your own personal situation. If you are living with somebody whose health is not great, in that they have an immune system problem, the elderly, they're on multiple medications, say for diabetes and heart and other things which can suppress your immune system, or you yourself have any of those conditions, I would definitely say stock up 5 or 6 swabs that you can do at will at home. But I guess if you're able to get to your general practitioner, as Bhavna and Rakesh have said, and if they get the stocks, then you don't have to worry about stocking them at home. You just go to the testing center, to your GP, or to the nearest hospital if you're sick enough. That's my take on it in terms of stocking up RAT tests.
Thank you. Bhavna, Rakesh, please jump in if you think you want to add something.
Bhavna?
Summarized it quite well. I know that the rapid antigen tests have been quite slow in getting to all the places that need them. They are in New Zealand being used for diagnosis at this stage because the COVID swab results are taking too long. They were, I think, not meant for diagnosis as much as checking if you were infectious while you've been a close contact or something like that. So I think wait another week. Most general practices in Auckland would have ordered some through their something called primary health organisation. So they've got instead of talking to the hospital for some, they talk to a different organisation who should be delivering them. So I see that some people have written a medical centre in West Auckland still doesn't have them. They will be on their way. We did have to stock up quite a few weeks ago. Our practice was stocked mid-January, so we've had to start using them last Thursday. And
Thank
like
you.
Suchitra said, we have there's something called critical workers in New Zealand. If you are a critical worker, you should have at least 5 RATS tests on site at home in case you need it.
Great, thank you. And I see Suchitra, Gargi, you mentioned medical center at West Auckland didn't have. Suchitra says until last week, all school kids had to get RATs weekly in Sydney. I know there are a few teachers here, if they don't mind, if they can write what is the policy with your schools, but now they have relaxed. What I found, Suchitra, is New Zealand is doing a catch-up. Whatever is happening across the ditch, we're sort of doing a catch-up, and that's how our rules are playing up. So it's lovely to have you and giving your comments. It's fabulous. Can I just quickly ask, I'll come to a very serious part, Suchitra, for you here. Do you want to give us a little spiel about, we have opened up, kids are going to school. What do you want to tell the parents?
Yeah. I am a strong believer in vaccination, number one. So anybody and everybody who is eligible in your country and who have access to the vaccine should be vaccinated unless there's a strong contraindication. For the simple reason, as Bhavna said in her initial presentation, that vaccination definitely reduces the risk of serious illness if you catch COVID. It does not stop you from getting COVID. Please don't go away with the idea. I had 3 shots of Pfizer mRNA vaccine, and day 5 of landing in India last month, I caught COVID. And I felt like I was run over by a truck for about 3 to 5 days. And then I got over it, and I'm here sitting in front of you. The reason why it's important to vaccinate is that although it does not prevent you from getting COVID infection, it reduces the severity of illness. And we don't know this yet. And we are hoping with all our fingers and toes crossed that it reduces the consequences of getting even a mild COVID infection. Because a mild COVID infection, whilst it's just a flu and you say, it's a mild illness, it's gone. We are seeing a number of patients here, and I'm seeing as a cardiologist, and I'm sure GPs are seeing much more, patients long-term with symptoms of what we are beginning to call long COVID. They are such non-specific symptoms, body ache, brain fog. A 28-year-old who would get up and go to the gym every morning can barely get out of bed and needs to get, push themselves to get out of it. All those sort of things. So these are the things that we have to worry about. So kids going to school specifically, I think it is now mandatory in Australia. I don't know if it's there in New Zealand, that all the school teachers and staff have to be vaccinated before they can come back to work. Kids are being vaccinated very quickly as we go along. And it's not, whilst children in general get almost no illness or very mild illness, I'm not a pediatrician here, but there is a very small fraction of children who can get very sick with this. So I think it's very make sure that they are protected from that illness. So the main thing is vaccination, number one. Number two, teaching your kids at home how to do the basic tenets of hygiene as we've been taught through the first wave, which is wash your hands frequently. The sanitizer you carry, it's available everywhere. With very young kids, I'm a little uncomfortable telling them to rub a lot of alcohol into their hands because I don't know what skin issues and other issues will crop up for them. I prefer soap and water. Wash your hands with lots of soap and water. Masking for kids is a big question, and very young kids, we say no. For the slightly more senior kids, yes, if you can't sort of keep apart from each other. And the other thing for parents is, even if it is hard for you to keep them at home another day and another day, even the teeniest of symptoms in your kids, please don't send them to school. Keep them home, get them assessed, make sure they're okay before they go to school. I think that would be my message.
Thank you. Rakesh, do you want to join in? You have kids. What are you looking out for every morning you wake up?
Yeah. Before I say anything, is it okay if I just ask Suchitra, your experience in Australia? You mentioned you've had 3 doses of Pfizer, but the initial vaccine that was rolled out there was the AstraZeneca one. How was it with the Omicron, or for that matter Delta? Was it any? I mean, did you feel that it was better or worse than the Pfizer in your experience?
No different.
No different.
No different in terms of catching Omicron. No.
Okay. Right.
But definitely, if you had the booster shot, you were less likely to get Omicron. It is still an evolving page, as you know. We're still, in fact, last 24 hours, we had 6,000 cases. So it's still sort of an evolving phase. I would say AstraZeneca or Omicron, Pfizer doesn't matter. You just get the vaccine that is made available to you. I got Pfizer because I was a cardiologist and I was on the COVID wards. So all of us were offered the mRNA when it came up. My husband, who is about 1.5 years older than I am, got AstraZeneca, the viral vector vaccine, 2 doses off, and subsequently got the Pfizer as the booster. Likewise, my mother, who was with me at the time, she also got the AstraZeneca. And guess what? Mum and Satish, as 2 AstraZenecas and Pfizer, no COVID when they land in India. Me, the 3 Pfizer, lands COVID. Go figure.
In New Zealand, we have nothing. In New Zealand, we have nothing but Pfizer. God.
No, please don't take a wrong message. Sorry, we do have non-medicals on this panel. I want you to people not take away the message that Pfizer is bad. Not true. Yes, there was a message out that mixing and matching vaccines helps, but when it becomes available to you, when that 4th shot becomes available to you, do it. But if that 4th shot is not yet available, do your 1, 2, and 3 shots now.
Fantastic.
And Suchitra, the second question: have you experienced? Have you been seeing a lot of cardiological complications of long COVID in specific? Like obviously you worked in India. So have you seen a whole volume of patients with that?
Yeah, so a lot is the wrong, no, it's a small fraction of people with COVID who are getting the cardiac complications, which is heart related, which is inflammation of the heart for the lay people on the group. They can get symptoms that mimic a heart attack. So they come in like they're having a heart attack, like they have a cardiograph change, they have a blood test change that mimics as if you're having a heart attack. Then you go and investigate them. They don't have any blockages in their arteries. They do get palpitations, which is basically an awareness of your heartbeat. So, racing heartbeats, skipped heartbeats, dizzy spells. These are things that we are seeing, and also inflammation of the sac of the heart, around the heart. The heart sits in a little shock absorber like sac filled with fluid. So with COVID-19, you can get an extra production of that fluid and can cause shortness of breath and issues related to that. So yes, we are seeing some, but we saw a lot of that during the Delta surge. When I say a lot, I'm talking about looking at some statistics on our own New South Wales Health website, is in the ballpark of about 100 to 150 out of 100,000 cases who tested positive for COVID. So it's still a very small number. So those people who come with problems and quite significant problems. Saw a lot of it during the Delta surge at the end of last year, not as much in the last 2 months. Having said that, Omicron is very new. It's only since December.
Thank you. Thank you, Suchitra. And I have to say here that while Suchitra she landed in India, she went into isolation, and then she resuscitated almost another patient who was in the flat upstairs. So kudos to you, Suchitra. Well done. Great
Just
stuff.
in the right place at the right time. That's all.
Yeah, we were really worried about you, but it's good to see you safe and sound. I have a question here from Gargi who says, can we use the rat every day if required at work? How safe is it? I don't think there's any safety issue. Bhavna, you want to take that?
Yes, I can take that. Yeah, so no safety issue. How worthwhile is it? I guess if your work requests you to, you go ahead, but the guidelines are you only really need it if you've been a household, for New Zealand this is, the guidelines for New Zealand, you only need to use it if you've come from a household where you're a close contact of someone. If you're symptomatic, you should be self-isolating and at home. There's very small groups of critical workers that could get around that, but symptomatics, stay home, asymptomatic, feeling good, household member, positive for COVID, you could use a rat test, have it negative in the morning before going to work that day, have it negative the next morning before going to work that day. So it shouldn't be a daily thing for months and months and months, just situational.
Can I also mention, thank you, Bhavna, can I also mention here the latest guidelines is you're symptomatic, you do your RATs, you count backwards. So 2 days before your RATs came positive is your day 1. So almost like on day 3, you've done your RATs, right? So you were symptomatic and you did your RATs, it came positive. So you think that you were sick 2 days prior. From there, you count to day 10. And that's when you need to repeat your RATs. And if it's negative, you're out. So those are the guidelines that have changed. That's the phase 3. We are not as stringent as we were before. It's a little bit more complex. Ask your GP, ring up the receptionist. They're trying to get their head around all these guidelines as we go. They're always evolving. There is a question here. Thank you, Bhavna, for that. Is a booster on the horizon for kids 17 and under? Bhavna, you want to take that?
Yes, I can take that. So no, there's no boosters on the horizon for under 18-year-olds at this stage. I'm wondering whether Suchitra can take over this a little bit. I understood that the rationale for not boostering the under 18-year-olds was that slightly higher risk of the long COVID or shortly after the booster having a slightly higher risk of myocarditis and pericarditis.
It's the latter. It is the latter, the higher risk of myocarditis, and that the youngsters have a better and more robust immune response. So the need for booster is probably not.
Okay, great, thank you. Shantilalji has asked, friend had rat test first and was positive. 12 hours later, swab test showed negative. Any comments?
So number
Yeah.
one, if you've got a rat test positive in New Zealand, at the moment in phase 3, which was official on Friday, it is a diagnosis, so you shouldn't then be going to get a COVID swab at this stage.
Yep.
For most people, it's been the other way round, where the COVID swab's not back yet and the rat test is positive. And so, yeah. Any other comments, Rakesh or Suchitra, on that one?
Yeah, I agree. I mean, like, there's no point in having another test for, like somebody who's symptomatic from the day they have symptoms, so day zero. I guess they have to self-isolate for 10 days. That's the government directive at the moment. I mean, if they get a test, that's just for diagnostic purpose, that they do have COVID and nothing else. And it doesn't really matter, because the test could be positive for about 3 weeks and sometimes longer. And it just does not really matter. If somebody is asymptomatic, say after the day 10, they can very well go back to work on the day 11. And that's the current guidelines at the moment. And somebody who's asymptomatic, they have to do the same for about 10 days from the day of the test. So I think doing a repeat test is not that important unless you're a critical worker, where you have to, because you have to be asthmatic and you have to be, that test has to come back negative for you to be able to go to work. So for us, for critical workers, for professional healthcare professionals, it does make sense to have a repeat test. And for somebody who's asthmatic, a household contact who is going to be going to work, a healthcare worker, or probably for maybe for border workers, I guess it makes sense to have these tests done more frequently. But for the general population, it's not of much importance.
Thank you. And
I agree with both of them that definitely you don't need a RT-PCR if you've done your rat test, number one. But to just step away from that, Shantilalji, the reason why the two tests can be different is that it just depends on how the swab was taken, how the swab was prepared. All of that are factors to give you a positive or a negative test. It could be just a lab.
Can I just come in here?
To do with how inside you. It just could be because all tests, come what may, none of them are 100% perfect. There's always some false positives, some false negative tests. So go with that. And if you've tested positive on rat, treat it as COVID, go no further.
I have one more thing to add about the COVID swab. So if your swab came back positive, it's going to remain positive for up to 3 months. So it's no point keeping on retesting for a COVID swab. Now, 60 to 70% of positive rat tests can turn negative after 7 days. So just be mindful of that as well.
Yeah.
Can I just comment here?
Yes, yes.
I saw my friend's the kit that he was given by as a rat test, and the rat test, as well as the instruction within that rat toolkit, also says that if the rat turns out to be positive, then you should go and get a swab test. That's what I have read in myself. So it's in there. So here's a little bit. I don't know what's right here.
Thank you, Shantilalji. Rats is manufactured somewhere else. Same kit is distributed all over the world. So all the guidelines are pertaining to New Zealand that we're talking about. That's why we're not even putting Suchitra in the hot seat when we're talking about guidelines. All countries have their own different guidelines. And as Bhavna tried to explain earlier, at this point of time, rat test in New Zealand is diagnostic. So there is no need to do it. Now, maybe in where? UK or maybe somewhere in Maldives, they might still be doing it. So that's a policy. But at this point of time, that's a confusion. We tell you something else, the kit tells you something else, so what to do? So just leaving it very simple. I hope I have been able to explain rather than extending myself. Is it okay? Does it answer my question? Yeah, thank you.
One more thing to that,
yes,
to add to that, Pramla, is 2 weeks ago, that was the right directions or instructions for New Zealand. If you had a positive rat, then please go and get the COVID, because the sheer number of COVID swabs being done in New Zealand is too overwhelming, we have now changed to TAC as of end of last week. So a rat test as of last week is all, if it's positive, that's all you need.
That's right. I mean, even in Wellington as well, I mean, we've never been able to offer the RATS test until now. And with the level 3 coming in, now this is the test of choice now. I mean, up till now, we were actually not offering this at all. So, I mean, things have changed so fast that everybody is kind of scrambling as to what is the right test to do.
Thank you. One word answer, Rakesh. Would you still recommend people should scan QR
I
scanning?
don't think, yeah, I mean, from practical point, you know, I mean, you could argue that it's probably a good idea to do that because you want to minimize the spread. But I don't think there is much practicality in doing that because it's out in the community. I don't think we can stop it. It's not a stamp out thing now.
Okay.
In the level 3, not
Thank
at the
you.
moment.
Thank you. Bhavna? Yes or no?
I think habits are hard to create. So I think if you're, I'm a little bit opposite Rakesh. I think if you're used to QR coding and doing the scanning, carry on. I think as the numbers decrease, the close contacts later might become important again. But I totally agree with what Rakesh has said. The sheer volume, it's everywhere. There's no point in, no one's going to contact trace anyone at this stage.
Thank you. We have few questions come through, so I'm just going to go quickly. If after day 10 rat, you can return negative tests, but you continue to be symptomatic, can you stop isolating and go back to work? Suchitra?
Right. You're still symptomatic, so you need to get yourself checked to find out what your symptoms are, not necessarily that you can transmit COVID. Going back to work depends on what work you do. Number one, it being symptomatic day 10 and rat negative. Forget the rat. Rat does not matter at that point in time. You were tested positive. You're day 10. You still have symptoms. You don't need to isolate. Number one, because the risk of you transmitting is low. Having said that, you be cautious and try and keep your distance from people who are likely to be vulnerable. Because as Bhavna said earlier, whilst the infectivity goes down, particularly with Omicron, quite early, after about day 5, day 6, the infectivity comes down, but you're still shedding some virus. And particularly in the earlier phases, we used to see RT-PCRs positive at 30, 60, 90 days also. You also see particles of the virus in sewage, in the water supply. So you're still shedding the virus, which doesn't, the infectivity is not huge with virus particles that are going out or almost negligible. So isolating does not come into play. You don't need to isolate, but you just need to be careful when you come in contact with somebody who is not well. And in terms of your symptoms, you need to go and get checked to make sure you don't have another bacteria that's affecting you. Yes, you started off with COVID, but if you're still coughing and spluttering, maybe you have a bacterial pneumonia now. If you have symptoms in terms of gastro, then maybe you need to go and get the gastro checked. So it's more to do with treating and don't ignore other illnesses just because there is COVID. COVID should not take over everything else, because people who have other illnesses forget all of that when there is COVID, but you please don't ignore that part.
Thank you. Thank you
I
very
hope
much.
that answers it.
Yeah, well said, Suchitra. Can I just add in here? Please don't forget masking. Ventilation, keeping the doors and windows open is one of the most important things. Please keep on before, after going to work. Just be paranoid about it. Just leave the doors open. And one little tip that we learned last time, when you flush the toilet, put the cover on. The lid should be on closed. It's really important because of the aerosol. I was told it's a normal, polite habit to do that. Otherwise as well, I doubt if every one of us does it. So during COVID, when you enter a toilet in the aircraft, at home, in a hotel, in a restaurant, you want to flush the toilet, keep the lid down, please. I will take an opportunity here. We have a couple of other questions, but I do want to mention, this is very dear to me, this topic about violence, family violence, abuse. Please keep an eye out for any such red flags in your community, in your neighborhood. During this pandemic, we have seen it has escalated, and it has happened in Indian communities. We in the community are hearing, we have been approached about, especially women and children, as we talk about. Even men do suffer. Let's not be sexist here. So please keep a very, very open mind. Reach out for people around you. Mental health has affected every one of us. See what is it that you can do that will help. Please don't underestimate the pressure that the healthcare professionals are under. It is massive. We're still trying to maintain our, smiling greetings and coping mechanism, but it has affected all of us. You have to come into a clinic on Monday morning to see the tension that is there, because everything has changed. The guidelines have changed, and everybody's trying to do the very best to keep the patient safe. So just be kind. Let's not forget that. Thank you. That was my little spiel. I just want to quickly ask, 10 days of isolation, is Omicron completely cured in 10 days, Rakesh?
No, I don't think anybody can claim that. But as Suchitra said, that the infectivity does reduce after that. So the whole point of isolating is to not let it transmit to other people, and it doesn't. No, obviously not. But it does. It's some kind. I mean, up till now we don't know about this virus, so I guess I will probably know in coming few months. But generally, it seems like it's infective from the first couple of days before the symptoms really start, and till about 5 to 7 days in general, and then the infectivity reduces. But definitely, by it doesn't. We know about for most of the viral infections, and I don't think it'll be any different. The symptoms can go on for a long time. I mean, we know that for average coughs and colds, the cough can last for up to 2 or 3 weeks, and I don't think COVID is any different. And obviously, we're not even talking about the long COVID. So by no stretch of imagination that the COVID is over in 10 days, I guess.
Thank you. I've got 2 other questions, and I know we wanted to finish at 6, but we don't have a limit on 6. We can go 5 or 10 minutes beyond time if people have any burning questions. I do want to address 2 things here, and I might actually come to you, Suchitra, first. Let me go to Bhavna. I can do this, right? I have the privilege of choosing. Thank you for being so accommodative. Bhavna, there are going to be moms here, there are young women, there are friends. What would you want them to tell a friend who is planning to conceive or who is pregnant? Is there something you want, a message for them? Thank you.
So I think this question's been raised in the medical world as well, and even by doctors having webinars with our maternity specialists, obstetricians. I think you should go ahead and plan to conceive. Some of the things you want to have in place, though, is, as like Suchitra has mentioned, vaccination. Make sure you get your boosters. Be healthy. Do plan to try conceiving, right time of the month, but do all the other things everyone else is doing: masking, hand hygiene, staying away from people who are sick, doing all the protection things. I don't think there'll be anything more specific than that. I think trying to start a family is very important. COVID's going to be coming, but it's also going to be going, with my positive, optimistic feeling. And you still want to carry on with life, but be safe.
Fantastic. And I believe that it is okay to breastfeed if a woman has COVID. Is that yeah? Suchitra, you're saying?
And to help the young mothers, there's definitely now lots of little studies coming out from around the world, and you can go away confident that you treat your pregnancy planning, family planning, pregnancy, much as you would do whether you have COVID or not have COVID. COVID, as far as we know, is not sexually transmitted. So the third thing is vaccination. does not cause infertility, which was something that was raised a lot and everybody was afraid. No, it does not cause infertility. Please get vaccinated. And heaven forbid you do get COVID-19 when you're pregnant. If you're vaccinated, you're less likely to have any serious issues. So make sure you get vaccinated at the right time. The last thing is once you've had the baby, you treat breastfeeding as normal, as Dr. Primla Khar has just now very nicely said. So I think no different from whether you had COVID or not COVID, pregnancy should carry on. In fact, we had a problem with all the IVF clinics were on hold in Australia, and wrongly so, because we didn't understand it. Everything was put on hold, but it's not now opening up, whether it was due to resources or not enough data, but now there's definitely enough data out there coming out in different countries that pregnancy should carry on as you would normally, irrespective of the pandemic.
Thank you, Suchitra. Thank you. Thank you, Bhavna, as well. Rakesh, there is a question, if you don't mind. Harud has asked a question. Do you want to, on the chat box, do you want to just pick that question? And if you want to write the answer for him, that'll be fabulous. While I, just in view of the time, there's one important bit. Suchitra, in April, we are going to get antiviral medication in New Zealand. It is going to be available. I was called this morning and somebody said, hey, I've just done a rat test. It's come back positive. And I said, can we do anything? Can we be of any support? And she said, can I get antivirals? So I think that'll be the next thing that'll be happening. So do you want to tell us in a minute or 2 minutes? What do you think?
Very new area, very new area. Also comes down to availability. And yes, there are a couple of oral antivirals coming up which look promising, but they have to be taken very early in the course of the illness. For someone who has significant illness, when they go into hospital, we, for instance, hit them with remdesivir, which is one of the antivirals, very quickly in the first 2, 3, 4 days. And they do much better in hospital. And as your sister Sunil has just said, yes, we do have them in hospital. Those are the injectables, Sunanda, the remdesivir and the Tossi and the Barry. Yes, but I presume Primla is talking about the oral antivirals, which are on the way. It's like giving your Tamiflu equivalent for when you have flu-like illness. That's in the pipeline. It is, I think, watch this space at this stage.
Great, thank you. And thank you, Sunanda, for your comments there. Thank you very much here for your input. If there is no other question, I might open up the floor and get Mr. Dhansukh for being so kind, being here on the Zoom. Do you want to say a few words? And then Gargi, it's all yours. Thank you. Or maybe, does any of the other doctors, Bhavna, Suchitra, Rakesh, great people, great doctors. Thank you very much. Do you want to say anything? Last 30-second comment or anything, Bhavna?
Just to say thank you for including me from across the ditch again. But one message to go away. Yes, we have Omicron now. We have Omicron BA1. Omicron BA2 has raised its head already in Australia. So it's coming. So we're going to have a lot of Omicron. The severity, the transmission rate, the symptoms vary from each variant. But please remember, it is still the same virus. It is the same virus. And I say this with a very heavy heart, which has affected some 430, 440 million people worldwide. It has killed close to 6 million people worldwide in the last 2 years. So it's not something to be taken lightly. However mild the illness, vaccine, masking, keep your distance from people if you're infected or having kind of symptoms. Cleanliness, wash your hands a million times. That's all I can say. And stay safe.
Thank you. Thank you. Stick around. Bhavna?
I don't think I have anything extra to add. Suchitra has said it all. I was going to say we can get through COVID. We really can. but everyone has to do it together. Everyone has to contribute. And the main things to contribute is be vigilant, follow directions, stay home if you're unwell, continue hand hygiene, continue masking, continue staying away from large crowds if you can help it. Lots of ventilation. Winter is going to come. It's going to be harder than the last few winters, but we can do it. We just have to stay with all the safety. Yeah.
Thank you. Love your positivity there, Rakesh.
No, I don't think I've got anything more to add. I think you've summarized it all.
Thank you. Thank you for looking after our chat as well. Dhansukji.
Yeah, thank you very much, Primalaji, first of all, for inviting to this session. Thank you, Suchitraji, Bhavanaji, and Rakeshji for great information. It's easy to understand when you're talking and getting questions answered rather than sort of reading a whole a biography of paragraphs of literature, etc. So it was easy to understand. And thanks for joining, and thanks for great information. And like everybody said, just keep well, keep safe. Thank you.
Thank you. And can I take an opportunity to say thank you to Dr. Sunanda Shipuri, who's joined from Brisbane. Take care, stay safe. Gargi, thank you for having all of us. It's yours. And thank you for what you do in the community. Thank you.
Now, I would just like to say once again that thank you to each one of you all, because today while talking to you all, and since there are so many people infected in Auckland, my phone has been buzzing since morning. Gargi, please record it, please record it, please record it. So I know that many of them couldn't attend it today because our group is a very large women's group, and they want this recorded so they can have listened to it in their own time. And it was very informative. It was very kind and very nice of you all to give so much of time to us today. Thank you so much, everyone.
Thank you.
Thank you.
Namaskar.
Thank you.
Everybody.
Namaste. Thank you.
Thank you, Primla.
Thank you.
Thank you, everyone.
Thanks. Bye.
Thank